Welcome to Davis County's Medical Benefit Education. Because the county is making several changes this year to benefits, we want to make sure that employees have all the information that they need to make the best decision for themselves and their families. So today we're going to talk about our medical benefits. We'll do a comparison between the traditional plan that you're used to and our new high deductible health plan, the STAR plans from PEHP. We'll introduce health savings accounts, health reimbursement accounts, and we'll discuss how this affects your current 125 flexible spending account, and we'll talk about a new limited purpose 125 flexible spending account. As a brief overview of the changes this year, the traditional plan, the deductible will increase from $1,000 per person, $2,000 per family, to $1,250 per person, $2,500 per family. No other benefits will change. The STAR plan, the deductible is $1,500 for single coverage and $3,000 for two-party or family coverage. So while those don't seem like a great deal different, the difference is in the way the deductible pays. So on the traditional plan, you pay the deductible on major medical. You don't have to pay a deductible for your regular office visits or prescriptions. On the STAR plan, you have to pay the deductible on all services until you have met the deductible. When the deductible is met, you pay 20% coinsurance on major medical with the traditional plan, and you pay 20% coinsurance on all services with the STAR plan. The out-of-pocket maximum is the same for both plans, and when the out-of-pocket is met, then the plan pays 100% on all eligible services. The other big difference in the plans this year is the change in the premiums. So the traditional plan has a cost increase and an increase to the employee's share, which goes from 10% to 20%. Employees who choose the STAR plan will pay 10% of the premium, which is lower than current year. Also, a health savings account contribution will be made for those who enroll in the STAR plan, $750 for single and $1,500 for two-party or family. We'll go into more detail as we go through the presentation. Employees have expressed concerns about the future of these benefits. The county commissioners want to assure employees that they are committed to making this plan a success and recognize that contributions to the HSA are an important component of this. So it is their commitment and their intention to do that each year. That said, they cannot determine what future circumstances might be, nor commit future commissioners to this plan. However, keep in mind that this is their intention and commitment. As a benefit history, general background, county employees have enjoyed a rich set of benefits for many, many years without the county passing on increases to employees. Since 2001, employees have paid 10% of the premium. Prior to that, it was 15%. And we've only had a $250 deductible since 2010. Prior to that, there was no deductible. Because costs continue to increase each year, it was determined in 2015 that we would make changes for the 2016 plan year of introducing a 20% premium share for employees, increasing deductibles, and offering STAR plans. That was postponed because we were able to negotiate a fair price by increasing the deductible to $1,000, so premiums were kept at 10% for 2016. That, however, is not going to continue. This year we were faced with an $800,000 premium increase, and so the 20% premium share and the offering of STAR plans is taking effect this year. In 2016, the county did a salary survey and implemented many market increases to bring us into line with the general market share around the Wasatch Front. We're also doing that with our insurance benefits, generally going to more what is being offered in the market. Many county and city agencies throughout the state have gone to STAR plans several years ago. So we need to take these steps to make sure that health care is sustainable for the long term for our employees. So consumer responsibility. With the STAR plans, employees need to take responsibility and control of their own healthcare spending. Milton Friedman, a famous economist, said that nobody spends someone else's money as carefully as they spend their own. So you will be in charge of spending your money with the STAR plan. With the traditional plan, you will put more money towards premiums rather than health care. So we're hoping by doing this that employees will become better informed about their benefits, learn how to navigate the PHP cost and quality tools, and use the pharmacy tools to find better prices. And by doing this, this will keep healthcare costs down and keep premiums down, as we said, to make healthcare sustainable for the future. So let's talk about premiums in more detail. So the traditional plan over the current plan year has a 6.51% increase, and employees will pay 20% of that premium. There will be no HSA contribution. It's not allowed on traditional plans. With the STAR plan, the premiums are a decrease over a current year of 4.1%, and employees who elect the STAR plan will pay 10% of the premium. They will also get an HSA, a health savings account contribution of 50% of the deductible for full-time employees. This will be deposited into their accounts the first pay period in July, $750 for single coverage, $1,500 for two-party or family. Eligible part-time employee premiums and HSA contributions will be prorated. The premium reduction that employees who make less than $50,000 have been enjoying over the past several years will be discontinued effective July 1st. A comparison of the premiums per pay period. Let's focus on family, which is at the bottom. Since most employees are on family, you can look at the premiums for your current situation. So currently, employees enjoy $70.40 per pay period, deducted on the first and second pay periods of each month. The 20% cost for the new traditional plan with the $1,250 deductible is $149.97 per pay period, so about $300 a month. The STAR plan at 10% of the premium for family at the bottom there is $67.51, so that's actually lower than your current premium. On the far right column, you can see what that savings is. So per pay period, employees with the family plan on the STAR plan would save $82.46 per pay period. So let's look at the premiums on an annualized basis. So currently, family coverage costs $1,689.60. On the new traditional plan, that will cost $3,599. And on the STAR plan at 10%, it's just $1,620.24. So you can see the savings there on the bottom for the STAR plan over the new traditional plan, $1,979 per year. If you add the HSA contribution by the county into your HSA, the cost savings annually for you are $3,479.04 for family coverage. So if you will consider putting that premium savings into your HSA to add to what the county has put in there, then gradually you can save up money so that you have it available for future expenses. And if you're putting money into your FSA, flexible spending account, consider putting that into your HSA so that you can add to that account to save for future expenses. So you can see how it works with the traditional versus the STAR plan. With the traditional, you're putting most of your money into the insurance premiums. With the STAR plan, you're putting less money into insurance premiums, and then you have the employee, the HSA, the spending account with the county's contribution and your own contributions to help you pay for those expenses. But if you don't spend the county's contribution, you keep that, so you can actually come out ahead. The STAR plan comes with two components. So there's the insurance component with PEHP. The STAR plans are a qualified high-deductible health plan that meet IRS guidelines. The other component to that is the health savings account. This will be administered by Health Equity. So just as a brief overview of health savings accounts, we'll talk about them in more detail later. So they are similar to the flexible spending account in that you use them to pay for your health care expenses tax-free, but the difference is that it is not use or lose. The plan rolls over from year to year. You own it, even if you change jobs. Your contributions and the county contributions belong to you. And you can put in more to an HSA than you can with an FSA. The one drawback to that is that you cannot have a non-high deductible health plan, which we'll talk about in more detail. So some disadvantages that people consider of a high deductible health plan and an HSA is that with a high deductible health plan, you don't have first dollar coverage except for preventive care. So you need to come up with the money in advance to pay for your coverage. And with an HSA, you can only spend what is in your account at the time you need to spend it. No advance funding like you have with the FSA. And it's not compatible with other traditional insurance. You have to have a high deductible health plan to have a health savings account. So you will need to determine if a STAR plan with an HSA is right for you. You'll want to review all of the documents, compare the plans, compare premiums, and you'll want to review your own utilization. Generally, the STAR plan benefits light users and heavy users most, so those in between will need to analyze their own utilization, and we'll have some instructions on that later. You can attend as many meetings as you want. View this video as often as you need to learn and understand these benefits. There are one-on-one sessions after you've reviewed your utilization and used the comparison tools. If you still need some help, call and make an appointment and we can meet with you one-on-one. Feel free to bring your spouse to any of the presentations. The Health Equity Comparison Tool will compare the two plans, and you can put in your own utilization to make it unique for you. So the provider networks are the same for your traditional plan and your STAR plan. So Summit Care and Summit STAR use the non-IHC providers, and Advantage Care and Advantage STAR use the IHC providers. So here is a detailed comparison for how the differences apply to the traditional and the STAR plan when utilizing your benefits. So this example is in-network for family coverage. For preventive services, there's no charge. Employees can enjoy those without any kind of copay. So the deductible on the traditional plan, $1,250 per individual, $2,500 per family. You pay the deductible on major medical. You don't pay the deductible on office visits, ER, prescriptions. So one person could pay the $1,250 for major medical, and then if a second person has major medical, they can pay up to the $1,250, or that can be met by a combination of family members, but more than one person has to meet that deductible. On the STAR plan, you must pay the entire deductible on all services first before the plan will pay, but one person can meet the family deductible. So you have to pay the $3,000 for two-party or family before the plan will pay. If you're on single coverage, you would just have to meet the $1,500 deductible before the plan would pay. So after you've met the deductible, on the traditional plan, for that first person who's met the deductible, their services will now be paid for major medical at 80/20. Then when the entire family deductible is met, then 80/20 will be paid for all family members for major medical. On the STAR plan, after you've met the deductible, then all services are paid at 80/20. So you would pay 20% coinsurance on your services after you've met the deductible. Pharmacy, on the traditional plan, you have the same 3-tier coinsurances. After the deductible is met on the STAR plan, then you pay those same 3 tiers. So your generic, your preferred, and your non-preferred. But prior to meeting the deductible, you would have to pay the entire cost. Once the out-of-pocket is met on both plans, the plan pays at a 100% for eligible in-network services. There is a difference on the traditional plan in that if one individual meets the $3,000 individual out-of-pocket maximum, then their services would be paid at 100%, and then once the $6,000 out-of-pocket maximum for two-party or family is met, then all services for the family would be paid at 100% for eligible services. On the STAR plan, the entire $6,000 out-of-pocket maximum must be met before services will be paid for 100% for two-party and family coverage. Single coverage, you would have to meet the $3,000 deductible before services are paid at 100%. So the in-network rate is what applies to your deductible and your out-of-pocket maximum. Just a brief overview of out-of-network. Of course, you're always going to save money if you use in-network providers, and it's your responsibility to make sure that your providers are in-network. Out-of-network benefits, you have a higher deductible on both plans, STAR plan and the traditional. Services, once the deductible is met, have a higher coinsurance, so it's 60/40. And then the traditional plan has a higher out-of-pocket maximum. And then remember that non-contracted providers can balance bill you the difference between the contracted fees and their charges. With the STAR plan and the traditional, there is one bucket, so your out-of-pocket, your costs accumulate together. So the deductible and the out-of-pocket maximums accumulate together. They're not separate. So this example shows how you would come out ahead on the STAR plan if you meet the deductible and the out-of-pocket maximum. So on the traditional plan, your out-of-pocket deductible is $1,250 for single, $2,500 for two-party and family. While the deductibles are higher on the STAR plan, you only have to come up with 50% of it because the county contributes the other 50%. So on single coverage, the deductible is $1,500. The county contributes $750, so your out-of-pocket expense towards the deductible is $750. Two-party or family, the deductible is $3,000. The county contributes $1,500, so your out-of-pocket expense for the deductible is $1,500. And then if you meet the out-of-pocket maximum, you would continue to pay your 20% coinsurance until you've met that. But again, with the STAR plan, your actual out-of-pocket is less than the traditional because of the county's contribution. So compare on single, $2,250 on the STAR plan, $3,000 on the traditional plan, $4,500 on the STAR plan for two-party and family, $6,000 on the traditional. Plus you have the premium savings, so you can see the added expense and for the traditional and the savings on the STAR plan. So $1,200 in premium for single and on the traditional and $540 on the Star Plan. For family, the traditional costs $35.99 and $16.20 for family contribution. This year we will be replacing our Aflac supplemental insurance with a new product, Voya supplemental insurance. This is compatible with an HSA. This will replace our Aflac, so those employees who currently have Aflac will receive notification and will be able to either convert their policy to an individual policy or enroll in the new Voya products. So they offer hospitalization insurance, critical illness, and accident. So they pay money out directly to you to help you cover expenses. So that can help you to meet those expenses that you will have towards the Star Plan deductible. The nice thing about Voya is that there is perpetual guarantee issue, so you will never have to answer health questionnaires. You must enroll during open enrollment, but if you don't want to enroll this year, then next year if you would like to enroll, you would not have to fill out a health questionnaire. So we're going to talk now about personal spending accounts. Just a brief overview so that you understand the acronyms. HSA stands for Health Savings Accounts. HRA stands for Health Reimbursement Accounts. FSA is your 125 Flexible Spending Account. And a new limited flexible spending account will be offered this year, and that has a limited purpose for use with dental and vision. We'll talk more about these as we continue. So, basics on the HSA. To be eligible to use an HSA, you must be 18 years or older. You must be enrolled in a qualified high-deductible health plan like the Star Plan. You cannot be enrolled in Medicare Part A, B, C, or D, and you can't have other traditional health coverage unless it's permitted by the IRS. So you can have another high-deductible health plan, but not another traditional type of plan or a TRICARE or VA benefits. You also cannot be claimed as a dependent on someone else's tax return. As mentioned earlier, you can only spend what is in your account, and you and your spouse both cannot have a flexible spending account or an HRA, and we'll go into more detail about that in a minute. You can have as the limited purpose flexible spending account for dental and vision expenses, and we'll go into a little bit more detail in a minute. So the great thing about an HSA is that the employee and employer contributions are tax-free, the money grows tax-free, and the money used for eligible qualified health expenses is tax-free. If you need to use the money for non-medical expenses, then there is a 20% penalty if you're under 65 and you would pay taxes due. Once you're 65, you just pay the taxes. There's no penalty. The account rolls over year to year, so you don't lose it, and it is portable. If you change jobs or if you change health plans, the money belongs to you and can still be used for qualified health care. You just cannot contribute to it unless you have a high deductible health plan. It is an interest-bearing account, and there are investment opportunities. So for those employees who are enrolled in Medicare, TRICARE, or have VA benefits, you cannot enroll in an HSA. Therefore, the county will deposit the HSA equivalent into an HRA for you, a health reimbursement account. You cannot make personal contributions to an HRA, but you can still participate in the 125 flexible spending account. Just as with an HSA, it can be used for qualified health services, and the account rolls over from year to year and belongs to you if you change jobs. This account will be administered by National Benefits, the same company that administers your flexible spending account. So an overview of how this affects your 125 cafeteria benefits. So as mentioned, with an HSA, you can't have the 125 flexible spending account. Therefore, you either must spend your account by June 30th, and your spouse must also spend their account by June 30th, or you can roll that money over into the limited flexible spending account, which can be used for dental and vision expenses. It also can be used for medical expenses once you have met your deductible. So generally, unless you plan to contribute more than the maximum to an HSA, it's more practical to put your money into the HSA because an HSA is not use or lose. You can still have a 125 child daycare account to spend for your child daycare expenses. And again, with the HRA, you can't contribute to it, so you can still put money into the flexible spending account. So with the HSA contributions, as mentioned, you must be enrolled in the STAR plan, and the contribution maximums are higher than the flexible spending account. The flexible spending account limit for 2017 is $2,600. You can see there in red, if you're under 55, the HSA limit for single coverage is $3,400. Two-party and family is $6,750, and that is based on a calendar year, and that is per household. So that includes employer contributions, so the amount that the county puts in. You can see on the far column is the maximum that you can put in subtracting the county contribution. So $2,650 for single and $5,250 for two-party and family. Now, if your spouse has their own HSA, then the combination between yours and theirs would have to be up to that limit. But if you are 55 and older, you can each put in an extra $1,000. So you can have an extra $1,000 above that limit, and your spouse also. If your spouse does not have their own HSA with their employer, they can open one with Health Equity. The nice thing about this is that you can change your deductions at any time, and you can make lump sums. Payroll deductions will be tax-free at the time of deduction. Lump sums, you would have to take the deduction on your 1040. Now, because we're starting in the middle of the year, we have a calendar year start date of July, you could actually put the maximum for this year between July and December, and then do the maximum for 2018. The qualification is that you must remain enrolled in the STAR plan through December of 2018, or refund, you would have to refund the amounts that were over the limits. Who can use an HSA? Based on IRS guidelines, you can use the funds in your HSA to pay for expenses for yourself, for your spouse, and for dependents that you do claim or could claim on your tax return. So if you're divorced and take turns with your spouse, your ex-spouse, claiming the children every other year, if they can be claimed on your tax return, you can spend your funds on them. So dependents who are older can still be on your plan up to age 26. You just would not be able to spend your HSA funds on them if they're not tax dependents. The nice thing about this is that your dependent could open their own HSA. This would not be done through the county's payroll deduction. You would make direct contributions to Health Equity, but they can also contribute up to the family limit, and they would get the tax benefits. So there are many things to consider when you make your determination on what plan you want to enroll in. If you have double coverage, you'll want to look at that closely and evaluate whether that will still be an advantage. Consider premiums and consider how the two plans will work together. Enrolling in the STAR plan may or may not be a qualifying event for you to terminate from your spouse's traditional plan. So check with your spouse's employer or plan management to see if they will allow you to do that in July. If they have a different open enrollment period, they may make you wait until that time. If that is the case, we can work with you to wait to make the contribution to your HSA until you can come off of your spouse's plan. Same thing with the FSA, the flexible spending account. If your spouse has a balance that can't be spent by June 30th, we can wait to put in the HSA contribution until that balance is spent. Also, for some reason, if you might want to enroll in the STAR plan but opt out of the HSA because the premiums are lower and you want to still remain on your spouse's traditional plan, you would not receive an HSA contribution, but you need to really consider whether that will be advantageous for you. So we can work with you on your situation if you give us a call. If it's something that we haven't addressed, just give me a call in Human Resources. Also, for those of you who may be approaching Medicare age, as we mentioned earlier, you cannot have an HSA and Medicare. So if you want to go on the STAR plan and continue that until you retire, you can opt out of Medicare. Once you're turned 65, you would complete the application and just check that you want to opt out and check the box that the reason is because you have an HSA. So how do you pay with an HSA? So when you go to the doctor or hospital, you want to show your PEHP health care card. This is how you get the in-network rate and how they apply your expenses to your deductible and to your out-of-pocket maximum. Some doctors may ask for a minimal payment at time of service. You just need to keep track of that if you have made a payment. So the doctor will send the bill to PEHP and they will adjust the price and apply the in-network rate, which is what you will pay. And then claims are downloaded to Health Equity. You can go to your member portal and then they have a great bill pay, so you just pay the doctor's bill or the hospital bill right from your account. With prescriptions, you'll want to show your PEHP card to get the discounted rate, and then you will use your Health Equity Savings Account card right at the time of purchase to pay for the purchase, and then PEHP will apply that discounted cost to your deductible and your out-of-pocket maximum. Now there are ways to get a discount on your pharmacy. GBS has a pharmacy tool that you can use. You can go to their website and download it to your phone. You can get coupons that will give you a discount, and you can compare prices between different pharmacies. This will be available on the website for access. Also, the $4 prescription lists that are available for most big box stores will be available on the intranet. PEHP also has a tool that you can use to compare prescription prices. You need to log into your account and find the cost and quality tools. But you can save a lot of money by using generics. Let's go over an example. So in example 1, this person is on single coverage and just uses the coverage for preventive care. So don't have any out-of-pocket expenses. So their medical costs for the year are 0. On the traditional plan, premiums annually are $1,199.76. On the STAR plan, premiums are only $540. Plus, the STAR plan employees get the $750 contribution. So actual out-of-pocket costs are $540, and they have $750 $250 on reserve for future services. So the realized cost is they're ahead about $210. So you can see, because of the HSA contributions and the lower premiums, those with little to no health care are advantaged on the STAR plan. This is an example of someone with moderate use, two-party coverage. Preventive care, of course, is covered at 100%, and these costs are just estimates, not based on what your experience may be. You can use the utilization tool, which we will go over in a minute, to get your own utilization. So there are a couple of office visits, a couple of specialist visits. On the traditional plan, costs are $90 as opposed to $450 on the STAR plan. In this case, we've got a $6,000 in-network hospitalization at an outpatient facility. So on the traditional plan, the person will pay the $1,250 deductible, and then they'll pay 20% coinsurance on the remainder. On the STAR plan, you have to meet the $3,000 deductible, so the deductible for the hospitalization is $2,550, and the coinsurance of 20% is $690. And then they each have some pharmacy costs, $130 on the traditional, $475 on the STAR plan. The traditional total medical costs are $2,420. On the STAR plan, they're almost double that, $4,165. But if you subtract the $1,500 employer contribution to the HSA, the STAR plan, your out-of-pocket medical expenses are only $2,665. Then if we add our premiums, we can see the difference between the two plans. So traditional, your premiums for two-party, $2,639. Your out-of-pocket expenses for the year are $5,059. On the STAR plan, your premiums are only $1,188, so your out-of-pocket costs are $3,853, considerably less than on the traditional plan. And here's an example with family coverage for catastrophic care. So preventive, of course, are covered at 100%. Office visits, $130 for traditional, $725 for STAR plan. This is an expensive inpatient hospitalization, $38,000. So the traditional plan, you pay the deductible and the coinsurance, and the same with the STAR plan, and on both plans, you've met the out-of-pocket maximum of $6,000. And that's what your out-of-pocket cost is on the traditional plan. On the STAR plan, we subtract the county's contribution to the HSA, so your out-of-pocket costs are only $4,500 as opposed to $6,000. And then you add the difference in the premiums. The cost on the traditional plan is $9,599 as opposed to only $6,120 on the STAR plan. So as you can see in these examples, those who have little coverage and those who have a lot of coverage are going to be better off on the STAR plan. As a component of healthcare reform, as we've talked about, preventative health services that are billed as routine services for a contracted provider do not have a copay, and the deductibles do not apply. So here are some cost-saving tips to help you save money. Of course, it's always going to save you money to use providers, and it's your responsibility to make sure that the providers that you use are preferred. You want to shop around. You can find many different prices between different doctors and different facilities, and ask about costs and discounts up front before you have services. A lot of doctors and facilities will give you a discount if you pay cash up front, and you can use the money in your HSA to help pay for that. Use PHP's tools and be mindful of where you're getting services. The least costly facility would be an office, and then next would be urgent care, and then emergency room, and then the most expensive is going to be hospital. So you should go to the facility that is appropriate for your level of illness or injury. Same thing with imaging and labs. There can be vast differences between different facilities, so check those out online using the PEHP tools. And keep in mind the PEHP Plus discounts. You can get discounts for items that are not covered benefits like glasses, contacts, and massage therapy, vitamins, those kinds of things. And PEHP has some discounts for Amwell and value clinics. If you go to a value clinic, which there are several along the Wasatch Front, with traditional coverage you pay a $10 copay, and with the STAR plan you get a 25% discount on the in-network cost. Amwell Telemedicine is an online service. On the traditional plan it's a $10 copay. STAR plan is a $40 copay before deductible and a $10 charge after the deductible. You download the app and you can have a face-to-face visit with a doctor, and he can prescribe medications. It's a great service. So check that out at the Amwell website, or go to PEHP for members. If you go to the STAR plan, you'll want to become familiar with the PEHP website. Even if you don't go to the STAR plan, it's a great idea to know and understand the website. They have all kinds of tools out there to help you find the best quality services at the best price. There's a YouTube video, you can see the link there, and we'll send that out to employees, that kind of goes through all the aspects of the tools on the website. So check that out so that you can become familiar with the PEHP website. To access the tools on the PEHP website, you will need to create your own user account. If you have not already done so, you will need your PEHP ID number and your Social Security number. Click on Create Your Personal Account and follow the instructions. On the website, there you can see on the screen you can actually track your spending towards your deductible and towards your out-of-pocket maximum. So you can just click on those two items and you can see where you are in terms of your deductible and out-of-pocket. You have easy access to a lot of information on the website. Up in the right-hand corner, you will always have a quick click to access your claims and to find a doctor and costs. And then in the middle, you can click on Cost and Quality Tools and Treatment Advisor. It behooves you to play around with those and get familiar with them so that you can find the best quality services at the best price for you. To review your own utilization, click on the upper right-hand corner, Claims. You'll want to choose All Members, and then if you want to find your claims for the current plan year, you'll put in the dates from July 1st to current. Click on Download Claims History, and then you can create and save it as an Excel spreadsheet or whatever other kind of spreadsheet you may have. You will want to look at what your actual costs will be. So you have your deductible costs, your co-insurances and co-pays, which you will be continuing to pay, plus the amount paid by PEHP. So that is what you will need to look at, is the combination of all of those. Take out any preventive services that they've paid for and any rebates that you've received on your Healthy Utah benefits. Let's look at what you need to consider when you're reviewing your utilization. Remember to determine where you are in your deductible and out-of-pocket maximums when comparing the two plans, because this determines your costs on the STAR plan for all services, and on the traditional plan it determines your costs for major medical. In this example, we've kept the same services each quarter for ease of calculation. So you can see the comparison between office visits and prescriptions on pharmacy. So from July to September, the cumulative cost is $500 on the STAR plan. Then from October to December, you spent another $500, so that's a total $1,000 cost, but your actual cost is zero because you're paying with the county's HSA contribution. From January to March, you have another $500, so now you've paid $1,500 in costs. Your out-of-pocket cost is still zero because you've been paying with the county's HSA contribution. A further $500 in costs from April to June. Now you're at $2,000 and you've had to pay $500 out of your own pocket because you've already spent the county's HSA contributions. So your total cost for the year is $500 for medical expenses on the STAR plan and $440 on the traditional plan. And then remember to take into account your savings on premiums. So for two-party, you've saved $1,451 on the STAR plan, and for family, you've saved $1,979. Let's look at another example where you actually meet the deductible. So these are more costs per quarter. And remember that once you meet the deductible, you pay 20% of office visits on the STAR plan, and you will now pay the same 3 tiers for pharmacy. So in the first quarter, your cumulative total on the STAR plan is $1,000. You're paying more in office visits and prescriptions. Your cost, though, is still zero because you're paying with the county's HSA contribution. In the next quarter, now you've spent $2,000 and you have had to pay $500 out of your pocket because the $1,500 is spent from the county's contribution. From January to March, there's another $1,000 in costs, and that is totaling now $3,000. So you've met the deductible, but your out-of-pocket costs have been $1,500. So now your costs on the STAR plan will be determined at 20%, so that's $77, which in this example is a little bit less even than your office visits. And you will now pay the same amount as you would on the traditional for your pharmacy, so $160. So the cumulative cost is $3,237. Your total cumulative cost for the year out of pocket is $1,737 on the STAR plan and $960 on the traditional plan. So you've spent an additional $777 in costs, but then factor in the savings on the premiums once again. In this example, we've met the out-of-pocket maximum. In the first quarter, we've had a $3,000 pharmacy cost on the STAR plan, $225 on the traditional. So in the first quarter, you've met your deductible. Your cost of that is $1,500 because you've used the other $1,500 from the county's HSA contribution. So on the STAR plan, you're now paying 20% on office visits and the same 3 tiers on pharmacy. So you're paying $462 a month or a quarter, and that adds up to a cumulative amount of $2,424 to March. In April, we have a surgery. On the traditional plan, you pay your deductible, $1,250, and your 20% coinsurance is $950. On the STAR plan, since you've met the deductible, you pay 20% coinsurance, which is $2,076. So the total cost is $6,000, and you've just paid $4,500 because of the county's contribution to that of the $1,500. So now for the next quarter on the STAR plan, you pay zero because your out-of-pocket maximum was met. So in this example, you have an additional cost of $680 on the STAR plan, but when you factor in the premium savings, then you're ahead on out-of-pocket costs for the year. And then in this example, it just shows where you are in your deductible, and out-of-pocket determines what your costs are. So in this example, you've had the surgery in October instead of April, so you've met that deductible right off the bat. and for the remainder of the year you have zero out-of-pocket costs, but you did have to come up with that amount, $4,500, by October. But bottom line, your expenses are the same for the year. And then you can put your individual expenses that you've gathered from your search on the PHP website into the Health Equity Comparison tool, so you can get a unique comparison for your own situation. And there's the link, and we've previously sent out instructions for that. With the PHP website, you can find providers and costs, so that you can compare costs between different providers and facilities. Then you can read reviews from patients that have used the providers. See this orange stars. If you click on the dollar amount, you can see costs for that particular doctor for each one of them and compare prices for services that they offer. You will see the in-network rate there. In the middle, you can access the cost and quality tools. There's a cost calculator, quality and code lookup, find a medication, and cost-saving tips. So check that out. The treatment cost calculator allows you to search out costs for a procedure that you may need. You can enter in the description of your service or browse. Then you can compare costs at different facilities. This is an example of an MRI, which, as you can see, is a lot more expensive at an outpatient facility than it is at an office. And you can further look at different costs between different providers on different procedures. The treatment advisor allows you to look at treatments that are available for a particular condition that you may have, and you can evaluate the best treatment for you. Thank you for watching this video. We hope that it is helpful and will enable you to make the best decision for you and your family. Continue to educate yourself about these changes so that you can make the best decision. We'll continue to email communications from Human Resources about these changes, give you all the up-to-date information that you will need. We'll have everything posted on the county's intranet site so that you can peruse it at your leisure. During May, we'll have open enrollment where you will need to actually enroll for all of your benefits at the infinityhr.com, and we'll make those announcements and send that by email. Health Equity has a website where you can check out more of their information and use the comparison tool to compare the two plans and put in your own information and get a unique comparison. There is a link there to an HSA video which we've sent out to you. So it's a general video, just shows you how the plan works, and then keep in mind what our particular benefits are that are offered from the county. Please feel free to call me with questions or email me. I'm Robin Kruger in Human Resources, the Payroll Benefits Coordinator. My number and contact information are there. Once again, thank you for your attention and good luck with your decisions.